So about 10 years ago or so, we started doing robotic surgery. And robotic surgery is really an extension of laparoscopic surgery, because in actual fact, robotic surgery is actually not robotic. It depends what you mean by robotic, I guess, but if you think that the robot is going to act and do something, you're going to be thoroughly disappointed. Unfortunately, or fortunately, the robot does nothing by itself. It's not an automated procedure at all. The reason why they call it robotic is because it looks like a robot, I guess, but essentially what it is that those laparoscopic instruments, like that we insert and we've been inserting forever in the body, instead of their being controlled by hand, they are controlled by a mechanism attached to a central machine, which is controlled by another machine, which is controlled by the surgeon. And why is that such an amazing thing? Well, it is an amazing thing because of several reasons. The first one is the camera. The camera, although in laparoscopic surgery is there and is the same type of camera, the control of the camera by the same person who's actually performing the surgery is a huge advantage, because you get superior optics, better control, and improved visualization by far. Another reason, which is probably the biggest reason why robotic surgery has allowed us to make huge improvements in surgical technique, is because of the articulating arms. A robotic surgery allows us to duplicate and scale down the articulating arms of the surgeon, which means, let's say for example, I articulate my arm like this at the wrist, like this. This articulation, okay, which I can perform right here, can be transported and duplicated in the body at areas where I couldn't have possibly, okay, put my wrist because of the tiny scale. So in that regard, in many ways, robotic surgery is like microscopic surgery. So for example, let's say I'm trying to perform a surgery deep down in the pelvis, right between the prostate and the pelvic bone. Okay? Well, there's no way I can put my wrist in there and start articulating it to perform microsurgery on the area between the nerve and the prostate, because that area is so small. I mean, even if I could see there, I could not articulate my arm over there because my arm wouldn't fit there. My wrist would not fit there. So what they did is they recreated the wrist articulation right after the actual grasping mechanism of the instrument. So you've got the instrument like this, and you've got an articulating joint right here, mechanical, and then you have the whole arm of the laparoscopic instrument. And the way we articulate this joint, which happens to be a couple of millimeters away from the actual forceps, is by scaling down and transposing the articulation from the console. So it's like I can move like this, and that will be like a tiny movement inside the body, replicated right by the surgical field inside the body. So that level of precision and that level of dexterity, okay, was just not possible with open surgery. Because with open surgery, if I have a forceps or a needle driver, I cannot articulate it right at the field, especially if it's a deep pelvic surgery. The only way I can articulate it is right here. But I have my wrist is right here, about 30 centimeters away from the actual site of the incision. So I can go like this, but it's very different from going like this. I don't know if I'm explaining it well, but the extra dexterity and flexibility has improved our surgical technique tremendously. It allowed us to improve our visualization, decrease blood loss, improve precision, to allow, for example, for a much easier a nerve spare and a robotic prostatectomy, much better visualization of the posterior bladder neck, much improved dissection from the posterior plane of the posterior prostate off of the rectum, much improved visualization and articulation to allow for anastomotic sutures between the bladder neck and the urethra, much better sparing of the urethral stump before the vesicular urethral anastomosis in the robotic prostatectomy. So all of these things added up make for an improved surgery and better outcomes. Now, there are surgeons obviously, who are superior open surgeons that have done it since they were born. And for those surgeons, you'll see outcomes that are just as good as robotic surgeons. But by and large, and on average, from the studies I've seen and from my experience, it is just easier, better, and less blood loss, and better nerve sparing, and better surgical outcome, and better overall outcome to do this surgery robotically rather than open. And it's also much less morbid for the patients. Patients go home the next day with the robotic surgery because they have maybe 5 or 6 tiny incisions, but nowhere do we cut the muscle in order to open the belly. And it's you know, and then an open belly and a closed belly is always easier to recover from, as compared to a big open surgery. So that's robotic surgery.